Namaste. This is module SL13, components of a research proposal. In this module, we're going to look at what are the various components of research proposal and how to develop them. So as we discussed earlier, clinical research is done to develop knowledge that improves human health and to increase understanding of human biology. So by doing clinical research, actually, we are providing evidence so that we can practice or we can support the evidence-based medicine by gaining new knowledge or providing more evidence for the current knowledge. And the EBM, or the evidence-based medicine, is the conscientious, explicit, judicious, and reasonable use of modern best evidence in making decisions about the care of individual patient. So our whole goal, whole purpose of doing clinical research is to provide evidence to practice medicine so that the patients can benefit. So the evidence-based medicine has three components: individual clinical expertise, best external evidence, which is the research, and also addressing patient values and expectations. So with that background, we'll also talk about proposal and protocol. Many times these are used as synonyms, but actually there is a slight difference between the two. Proposal means a document written with the purpose of obtaining funds from granting agencies or for getting the ethics review board's approval. So the proposal includes structured protocol. So protocol is also part of the proposal. But in addition to the research protocol, it also has budget, administrative support, research environment, and other necessary information. Whereas a research protocol is basically a detailed plan of the study with the purpose of guiding the work necessary to accomplish the study. So it actually includes all elements of the study to enhance scientific rigor and efficiency. So although these are used in common language as synonym to each other, actually there is a slight difference between the two. So today we're going to talk about the research proposal, which is the whole comprehensive plan for research. So the purpose of research proposal is to raise the question to be researched and clarify its importance, to collect existing knowledge and discuss the efforts of other researchers who have worked on the related questions, also known as literature review, to formulate a hypothesis or it could be both, and objectives, so hypothesis and objectives, to clarify ethical considerations, and to develop methodology required for accomplishing the research work and achieving the objectives, and to discuss the requirements and limitations in achieving the objectives. A research protocol, on the other hand, actually helps the researcher to plan and review the project steps, step by step, the scientific data collection, and serves as a guide throughout the research project. And also it forces time and budget estimates. So drafting the protocol correctly will increase the likelihood that the conclusions drawn from the research are scientifically sound. And this should always be added by or with the recommendation suggestions from other experts as well as colleagues. So coming to the actual components of research proposal, it consists of various different components, and the components that are used or that are part of the research proposal are title. Abstract summary is not always required by the institutional review committees, but many grantors as well as many institution or ethics boards actually require an abstract, scientific abstract, and maybe either scientific or lay research summary. And we'll get to that later on. And similarly, introduction, which consists of background and significant and rationale of the work. Objectives could be general, specific objectives or specific aims. Methodology, which is the comprehensive plan, research plan. Timeline and milestones, ethical considerations, budget and justification for budget, very important. Investigators and environment to support the research. References, appendices, collaborative agreements as needed, and dissemination plan or the plan for presentation and publication. So the title, coming to the first topic, the title is the one that gives first impression when a reviewer receives a research proposal, whether it's a grantor or it could be an ethical review board member. They will get the first impression by just reading the title. If the title is not understandable or comprehensible, first of all, that's a bad sign. Similarly, if the title is not written well, that's also a bad sign. So the title should be succinct and attractive. It should reflect the content and design of the study, including specific details indicating at least the research area and the goal, very simple or straightforward language, which is understandable by most people. State the research problem and approach, use appropriate keywords, and make it attractive and concise. There's also an acronym, SPICED, for writing research title, which means setting, population, intervention, condition, meaning disease or physiological condition, endpoint, and design. So we can look at these titles and decide how these titles look. First title, a study to determine the efficacy of beta blockers in heart failure. Okay, so you can think about how this title looks. So this title has some redundancy because it says a study to determine the efficacy. So this is not necessary. Those words could be made more succinct. So it could just be determination of efficacy of beta blocker in heart failure, but it's also not complete. The next one, a novel study on the usefulness of PCR test in diagnosis of dengue fever in Nepal, an analysis of clinical features and comparison of PCR test and serological test with clinical follow-up in 500 patients of dengue-like illness at XYZ hospital's medical ward. So what do you think about this? This is too many redundant words. We don't need all the details of the clinical follow-up and number of patients and things like that. Next, blood PCR for diagnosis of scrub typhus in children. How does this title sound? It feels a little incomplete because we don't know what blood PCR test is being compared with, or is it just being tried to see that the data collection or prevalence in the children. So it's not clear what this study intends to do. How about the next one, vitamin D and severe asthma? Clearly, it's too short, doesn't tell you anything. It just looks like a research, not a research article, but more like a review article. And finally, the last one, vitamin D supplementation in children with severe asthma, a randomized controlled trial. Looks like this is a good title. Okay. So if we break down that last title, vitamin D supplementation in children admitted with severe asthma, a randomized controlled trial, It has setting, inpatient or admitted patients, population, children, intervention, vitamin D supplementation, condition, severe asthma. Endpoint, probably it's not required in this particular study. And design, randomized control trial. Probably we can say that endpoint improvement in vitamin D level or decreased fracture, but probably this research does not intend to go that far. After title, background is the next part or component of the research proposal. So in background, we should not write all the history and geography or the details of a particular disease or a particular drug. The background should be concise, a couple of paragraphs or a few paragraphs, not more than, even in a big grants, not more than a few pages. So what we're trying to do here is to show why this study is necessary, what is the research gap, and how this research is going to be important, what is the significance of this research. Also, give some background on either from the literature or preliminary data to support that there is some scientific basis. What is the scientific basis? Maybe it could be a mechanism of action, or it could be previous data to support your research question. And highlight any innovations. So scientists always like innovations, novelty. So always show what is the new thing being achieved or being addressed by this project. And if it's a totally new idea, there's no preliminary data, no literature to support your work, then plan for a small pilot study to generate your preliminary data. So the three things that usually the grantors, big grantor agencies look at are: what is the rationale of the study? What is the significance? What is the importance of study? And what is the innovation or new approach or new ideas being generated in this study? So these are the things that need to be addressed in the background. Third component is abstract or summary. This is not always required by ethical boards, including Pattern IRC, but the many proposals may require scientific abstract so that the reviewer can read or conceptualize what is being done before reading the full proposal. And also, they require research summary so that lay people can understand it, because the IRB or IRC requires to have a layperson, maybe a lawyer, or maybe just a regular patient representative or a layperson from the community. So they need to understand the research too, because they are also on the board to decide or approve the project. So it's important to have a lay summary. And many times the proposals for the grants also are posted on the website. So also website requires a lay summary. So abstract is a summarized version of the research project. It starts with research questions, just similar to writing an abstract for a paper. So brief description of scientific approach methods and highlights of why the project is important in this case. Whereas lay summary is the project highlighting its significance in layperson's term so that a non-medical member of the ethical or grant review committee can review them. And also it can be posted on website, social media, or even for the purpose of study volunteers. Fourth component is objectives. So objective can be divided into general objectives, which addresses the overall or overarching objective of the research projects, and then they can be broken down into specific objectives or specific aims based on general objective. Specific objectives should be components or subcomponents of general objectives. So if you have an overall objective, then it can be broken down into a few subcomponents. And then hypothesis is based on the general or individual specific objectives. So hypothesis can be formed for the whole general objective But if it has several components, then each specific objective can have one hypothesis. In case of clinical trials in cohort study, instead of writing specific objectives, sometimes study outcomes or endpoints are also written. The primary objectives and secondary objectives, many times the researchers get confused. So the primary objectives should be tied up with the specific subcomponents of general objectives. So the primary objective should be part of the general objective broken into different subcomponents, whereas secondary objectives may be something that is not related with the general objective, but additional data collection. For example, maybe demographic data collection, prevalence data collection. So that is considered as secondary objective. So some of the examples are here. Clinical and economic burden of drug-susceptible TB in Indonesia, national trends from 2017 to 19. So that's the study title, and objective is also to assess the trends in economic burden. Whereas specific objectives can be to assess the trends in incidence, prevalence, and mortality rate during that period, to calculate the treatment success rates. So that's the second specific objective. And the third is estimate the economic burden for the patients in terms of direct medical cost for treatment of TB. So these are the three parts of the same general objective. So objective and specific objectives. In this second one, it's a mixed method cohort study to show the relationship between clinical language and success of behavioral weight loss interventions. And the overall objective is similar to the study title, whereas outcomes have been divided into two different groups. One, primary outcome, weight change from baseline at 12 months. So that's the whole study is about, and they will be looking at the sample size also based on that primarily. But at the same time, the researchers also wanted to see the secondary outcomes, including agreement to attend the weight management program, which is not actually on the study title or a primary objective, patient-reported satisfaction, and attendance at the weight management program at 12 months. So these are all secondary outcomes they are also looking at. If you really want to prove all of those or look at all those outcomes, maybe you may have to calculate sample size based on all 4 outcomes, or you might just choose to do the sample size based on primary outcome, and the other outcomes could just be the exploratory questions. Similarly, on the third one, the telemedicine versus in-person primary care treatment and follow-up visits. So they are actually comparing the treatment and follow-up visits, and they, instead of writing specific objectives, they have decided to write hypothesis, and there are 3 components of the hypothesis in this study. So make sure the objectives can be completed within the typical time frame or the time frame that you have. Should tackle important research question within your niche. So it should be something that you can handle and your team can handle, your specialty can handle, be able to move forward your field forward. So something that your field will welcome during the publication, and strongly supported with your own preliminary data or published data by others. You want to rationalize and support, show that actually you have a valid scientific question. Next, the main component of the research is the research methods, and usually this is the largest component. It includes study design, whether it's descriptive, qualitative, analytical, retrospective case control, case series, or cross-sectional, or prospective studies, observational cohort study, or interventional clinical trial. It will also be retrospective cohort, randomized or not randomized clinical trial, double-blinded or open label if it's a clinical trial, controlled, placebo-controlled, or controlled is standard of care group, or it is just uncontrolled clinical trial without a control group. Then in research method, we also need to mention who will be the study subjects, include inclusion criteria and exclusion criteria, where will be the subjects recruited from the hospital, from the community, from the outpatient clinic, etc. Randomization, if it's a clinical trial, is it a randomized clinical trial? And if it's randomized clinical trial, is it a simple randomization, cluster, stratified? The sampling technique, is it a probability sampling technique or non-probability sampling technique? Interventions, what kind of interventions are being given? If it's a drug, need to mention dose, route, duration, follow-up, how often the patient needs to follow up. What are the adverse events? What are the serious adverse events? And how the adverse events will be monitored and reported to the authorities, IRB, drug authorities, and as well as the patient and their family. Labs or other investigations, study timeline, informed consent process, how it will be done, who will take the consent, and where the consent will take place, and limitations and remedies, validity, reliability, alternatives, etc. And then also the outcome measures and study endpoints. What is the outcome of interest in case of, especially in case of cohort design or the clinical trials. And in clinical trial experiments, outcomes are assessed in terms of efficacy endpoints, with primary endpoints and surrogate or secondary endpoints that we'll talk about later in the clinical trial component. Similarly, biased and confounders, types of bias, what type of bias can occur, what kind of confounders can occur in this case, in this particular research. Data collection, management, and analysis should also be mentioned or planned in the proposal. And then there could be additional special considerations, such as if it's a multi-center studies, what are the sites, who are the investigators, and how the ethical review board approval process will take place. Also distribution of drug or any kind of tools required by the other centers, and how the data will be collected from various centers, those should be defined. Next, investigators initiated clinical trials may require the permission from various agencies, such as drug agency, central ethical board, review board, etc. If there are animals used or select agents, biological or toxic chemicals, the approval from concerned authorities need to be taken. Similarly, if there's a use of stem cells or genetic information, that requires special ethical consideration. And if there's a storage of tissue or genetic materials, there's also additional ethical issues that need to be addressed. Next, coming to the research timeline. Generally, the research are divided into preparatory, investigative, and analysis and presentation phase. So in the preparatory, begins with the literature search, proposal writing, research team meetings, IRB training and submission, and then, of course, the IRB takes some time for approval. If there is a funding resource needed, then grant submission and waiting for the funding. And if the study requires training, the study team should be trained during this preparatory phase. Once the IRB approves the research protocol and proposal, also if there's a funding is assured, and once the team is ready, well trained and ready to start the research, then the investigative phase takes up. So investigative phase includes implementation of the interventions, if there are any interventions, implementation of the tools for data collection, sample collection, if there's a lab work or additional examination that should also be taking place during the investigative phase, and data collection and management. Data management are important components of investigation phase. And finally, after the data collection is over, then this goes to the next phase, which is the phase of data analysis, interpretation of data. And once data is interpreted and we have the final results, then the phase of writing abstract, submission to the scientific meeting and presentation at scientific meeting. And after getting feedback from other experts, then the research can be converted into the manuscript and submitted for publication. So typically 3 to 6 months for a preparatory phase, and the investigative phase could last from anywhere from few months to several years, depending on the type of the research and the data being collected. And the analysis may take a couple of months to a few months, and presentation depends on when the scientific meeting takes place. And publication may take additional 3 to 6 months. So this is the Gantt chart where we plot timeline. This is something that can be done using Excel, and Excel actually gives you a template, provides you with a template. This is something I prepared myself using the Excel template. So preparatory phase, investigative phase, analytic and presentation phase, and you can see the different components and the time from anywhere from 2 to 3 months for other phases, and for investigative phase, about 6 months. Ethical consideration is also very important, because it needs to be, the research projects involving human being needs to be approved by ethical board, or maybe it will be waived if it's a retrospective data without any intervention. Informed consent process is also ethical consideration. The informed consent form should be as per ethical guidelines provided by your institution or by the ethic review committee of NHRC. There's also, we have to ensure that there's a data security and confidentiality, how, if it's stored on paper form, how it will be stored and how it will be secured from being data breaching. And also, if it's on the computer, how the computer is protected with the password or other types of security. In ethical consideration, it's also important to consider how the vulnerable groups will be included or excluded, and what is the justification for inclusion or exclusion of vulnerable group, and how the consenting process will take place for the vulnerable groups, such as very elderly or neurologically deficit people or children and pregnant women. Budget is the next component, and budget should always be paired with budget justification. So a detailed budget by categories such as personnel, equipment, supplies, patient care, travel, transportation, miscellaneous should be there. And for each item, the budget should be justified with the argument why the budget is needed to achieve the project's aims and objectives. So these are the various components of budget and budget justification. So direct cost, personnel, how much and why the investigator salaries are needed, what is the percentage of time which is given in terms of FTE. FTE means full-time equivalent. So if somebody is devoting 50% of their clinical time, then that's considered as 0.5 FTE, full-time equivalent effort. Research staff, similarly, why research staff are needed and how many research staff are needed, full-time, part-time, all those things should come under the personnel. Next, equipment and consumable. Usually equipment are not supported by small grants, but if there is a need for equipment, it has to be justified and tied up with the research objectives. Travel, if there is a travel for the researcher to get to the patient, or maybe moving patient samples, meaning the transportation of the labs, or maybe the patient need to come for follow-up, that can also be entered under the travel. Similarly, if there is any educational cost for presentation publication, many grantors can also provide or support the funding. And contractual agreement, if there is any contract or any other labs or other institutions are involved, what kind of contractual agreements will be there? That should also be there in the budget justification. The indirect cost is the administrative overhead cost, and depending on the grantor, they may allow so much, only so much, and your institution might have the actual percentage they keep as administrative overhead for the institution. The next component is investigation environment. It's important to have investigators who can perform the research and accomplish the stated objectives of the research. So there should be a description of team members, experts, advisors, etc. Similarly, team approach, PI, principal investigator, co-principal investigator, coordinator, data collector, data manager, maybe statistician, or senior advisor, or collaborator from other institution or other department. Research effort for each personnel should be mentioned, as I said earlier, 0.5 FTE means 50% effort of your time, or maybe it could be 0.2, which is 20%, etc. And the ethics review board as well as the grantor also require to submit all the investigators' curriculum vitae or by sketch, depending on which one they require. The research environment institution support is what kind of support system is there at your institution? Is there a lab required for doing the study? Are there computers, X-ray machines, CAT scan, CT scan, or research room for examination of the participants, etc.? And what kind of support is being provided by the institution in terms of human resources and equipment, accounting, etc. And generally, the grantors require some kind of letter of support from the institution. Then you should also include references and bibliography, not to show, a long list of references, but the references which are relevant to the project and which you have used for your write-up. Similarly, appendices should include data collection tools, informed consent forms as necessary, collaborative agreement with other institution or within your institution between different departments, and plan for dissemination of results and publication policy should also be the part of the research proposal. So if we look at our PAHS IRC research application, it has title, introduction, cannot exceed more than 250 words, and citations or the references only up to 10 references, methods, list of cited references, additional information including budget, work plan, Gantt chart, the timeline, data storage, sharing, and dissemination details, information sheet and consent form, information sheet for the participants, which goes with the consent form, pro forma, which should include study title, inclusion, exclusion criteria, demographic, study outcome variables, etc., and dummy tables as per each specific objectives. The UGC grant application, the University Grant Commission, gives all these different components. We don't have to fill out all of those components, but majority of the components should be filled out because they give certain number or score for each of these components. So I'm not going to read through these, but this is what the UGC grant application looks like. So in summary, the research proposal should be formatted depending on where you are applying. So you should follow their format. It should be comprehensive and need to follow the instructions and format of the institution authority where it's being submitted. The title, objectives, methods, and data analysis plan. All this should be tied up with each other So the title should be the same or reflecting the same thing that the objectives are stating. And the method should be developed on objectives and specific objectives or specific aims so that the method will be addressing all of the objectives. And the data analysis should be based on the methods and the objectives so that you can actually analyze and you get the results as stated in the objective. So all these four should be tied. And this is what the reviewers look at, whether the title, objectives, methods, and data analysis plan are tied up with each other or not. So if they are not tied up, then you cannot achieve the stated objectives. So it's the very important aspect of writing research proposal. The budget should always be justified based on objectives and methods, and the timeline should be realistic. So with that, this is the conclusion of SL13, the components of a research proposal. Thank you.